Universal health coverage ensures that all people have access to health services, which include promotion, prevention, treatment, rehabilitation, palliation of sufficient quality to be effective without exposing the user to financial hardship. Universal health coverage is also included in the Sustainable Development Goals as Target 3.8, and there are two important indicators under this, 3.8.1, which is service coverage, and 3.82, which deals with financial protection. I will just go through some of what the ministry's focus is in relation to UHC implementation. To ensure the successful and sustainable implementation of universal health coverage, it should not be implemented as a vertical program, but can only be sustainably achieved with a stronger emphasis on primary health care and also a quality framework. So the primary health care approach and also the quality framework form the backbone of a successful UHC implementation. The primary health care approach can contribute to identifying and expanding service coverage, ensuring that the essential services are available, accessible, and acceptable, that the health services are integrated across the full spectrum, and also high-quality primary care and essential services are available. The health functions are purposefully positioned as the core and organizing principle enhancing access. It also reflects the needs, the preferences of the people that are identified, that are planned and also delivered. And it's also important that persons are empowered as planners, co-creators, caregivers, and self-carers. And it also prioritizes those that are most in need. Using the primary healthcare approach also ensures enhanced access close to where people work, where they live as well. And it addresses the determinants of health through a multi-sectoral policy and action, ensures that persons are thoroughly engaged. The PHC approach also contributes to identifying and expanding the cost coverage, as we note that in PHC-oriented health systems and society, the financial barriers for access for essential health services are removed, and health-enhancing environments decrease the risk and the cost of ill health. We also note the importance of government's responsibility and accountability, that there is that balance which allows that healthcare to be affordable. The other pillar that I spoke of was the importance of a quality framework to ensure the sustainability of health systems. And as you noted from what Dr. Eugene explained on the implementation of universal health coverage, it has entailed the development of standards and guidelines, and this is the priority for us under primary health care. For those of you who may be aware, we have increased the number of senior medical officers to our team, and the first point of action is the development of guidelines for all of the health conditions that we manage within primary care. We're starting with primary care and our urgent care facilities. So we are preparing standards for every condition to ensure that there is a standard of care that we can keep our healthcare providers, and they're also developing the various SOPs. So it's important for the development of standards and guidelines, the strengthening of the workforce. We have been increasing the number of physicians, nurses, and officers within primary health care. The importance of implementing quality measurement systems, the promotion of patient-centered care as well, and also utilizing technology for data. And this is crucial if we are to implement universal health coverage in a sustainable way, because it's not just providing care, it's ensuring that the care is evidence-based, and the quality of the care to get the results that we are looking for. So what we are looking to do is the improved health outcomes, and because quality care will ensure effective diagnosis, treatment, and the prevention of diseases. Also looking at patient safety as well, ensuring equity in the health service, because one of the aspects of UHC has to ensure that it starts with those that need the service the most. Also, given the limited resources in developing countries, of which St. Lucia forms a part, we have to ensure that there is a level of efficiency so that whatever resources that we get, we can utilize it correctly and not spend it unnecessary because of errors within practice. There's also one of the areas that's extremely important if we had to get our patients to continuously utilize our services, and that is the trust and utilization of our services. Persons are more likely to seek and adhere to health services that they see are effective. The other area would be the economic benefits. When you invest in quality care, it reduces the economic burden on families and the health system by minimizing unnecessary treatments and preventing long-term complications. And this is one of the areas that makes primary care the most cost-effective investment within health care. And St. Lucia, we do not work in isolation. We work utilizing some of the regional and international guidelines. So we are also working together with the international organizations, including the Sustainable Development Goals, which I indicated earlier, Goal 3, which speaks of good health and well-being. So it's also important that the global health goals are also aligned. So the approach which is being used is correct, not having vertical programs, but ensuring the strengthening of existing primary health systems and the strengthening of primary health systems, and also ensuring that there is a quality framework in place to ensure sustaining the universal health care implementation. So I take the opportunity to congratulate everyone. I know it's a full team working towards universal health care as we continue working towards full implementation. I thank you.